Hello, I'm Dr. Aruna Muralidhar, a senior obstetrician and gynecologist at Fortis Richmond Road. Today, I'd like to speak to you about care during your first pregnancy. It is important, firstly, to understand that seeing an obstetrician and gynecologist before planning a pregnancy is most important. This is because we could make sure that you're in the pink of health to embark on the journey of pregnancy. This involves a preconceptional counseling about, just understanding your background, your medical background, social background, as well as family background, and also starting off, giving some investigations to be done, which will determine whether you are healthy to go ahead. Also, folic acid, which is a vitamin which prevents neural tube defects, can be started off. If that is done, the pregnancy is likely to be more smoother with better outcomes. Once you are confirmed to be pregnant, it's important to see an obstetrician and gynecologist as early as possible so that, again, certain blood tests could be initiated, a certain amount of investigations could be done, examination could be done, and then we would then ask for an ultrasound scan for checking the heartbeat and the number of pregnancy, sacs, for example, twins, and see if there's any other issue in the scan, an early pregnancy scan. Following that, we ask you to come for regular checks every month, 28th week, which is 7th month, and then every 2 weeks until the 9th month, the 36th week, and every week thereon until delivery. So it's important to get these checks done regularly because we don't want to miss out on certain issues like excessive weight gain, blood pressure issues, urine infections, and also to check how the baby's growth is going on. There are important vaccinations to be given to pregnant women. There are 3 of them. One is the flu vaccination to prevent seasonal flu. The second is a tetanus shot. The third is a tetanus, diphtheria, and pertussis triple vaccine. And these are all to prevent infections for the baby. Other than the scans and the vaccinations, those of you who have been deemed to have high-risk pregnancy, for example, twin pregnancy or a previous history of miscarriage or a preterm delivery or a previous high blood pressure or medical problems in this pregnancy, such as high blood pressure, diabetes, thyroid, asthma, or a smaller baby which is growing inside, etc., it is important. It is more important for regular antenatal checks. For example, diabetics may require regular sugar readings, maintaining sugar charts, seeing a dietitian, and also initiating on tablets or insulin depending on the sugar readings. So all in all, first pregnancy requires a certain amount of important tests, important interventions, and that should be done by an experienced obstetrician and gynecologist. Those of you who have been deemed to have a high-risk pregnancy, please choose your hospital and obstetrician carefully and let the setting have enough support to give you the requisite help during your pregnancy. For example, neonatologist team is very important to manage a preterm delivery or preterm baby. Similarly, diabetologists are important to manage diabetic pregnancies. So this is extremely important to understand and choose. And it's important to make a birth plan in the 9th month so that you're aware of what your options are, how your labor and delivery will be dealt with, and what are the hospital protocols that we follow, and whether or not adequate sort of facilities are available, all these, and whether your obstetrician is somebody who could give you a nice normal delivery as much as possible. So all in all, it's important to choose carefully and wisely, and wishing you all a very, very happy pregnancy. Thank you very much.